Hello everybody. Today's I'm going to be going over recoveries and a few of the important ones and why it's important to follow these procedures after why it's important to follow on the recovery and follow the steps that your dentist gives you in terms of recovering from the procedure that was just done. So as always, I'm not a dentist. I just have many years of experience in the dental field. Uh, Going over with dentists with patients and what they have, what the dentist found, how to take care of it, and what they can do to prevent it from happening, and also what potentially could have caused that to happen. So without further ado, recovery from procedures. So there are different types of procedures. Obviously, there's many of them, and most of them, for the most part, have a steps that you have to follow after to recover from these procedures. So, for example, when you get an extraction, there are a lot of things that you have to do for at least 24 hours to make sure that you don't have any pain continuing, and you don't have to come back and get any other procedures done because you might have gotten what's called a dry socket. So one thing that you have to do specifically when you get extractions is, one, you can't pick up anything heavy. You have to make sure that you don't eat in the area. Eat only soft foods, nothing small, because you don't want anything getting in the wound. You definitely have to rest. The doctor is going to prescribe you antibiotics and painkillers because you definitely don't want the area to get infected, and also it's going to help you for your recovery if you have any pain. Now, everybody is different, and also extractions are pretty different with everybody. Everyone has a different pain tolerance. There are people that sometimes don't even need painkillers. They're like, oh, I never took any painkillers. I was perfectly fine. And then there are people that are in severe pain and they need painkillers or they feel they might die. But everybody's different. Regardless of it, the doctor does prescribe it to you. And you definitely, for sure, on both situations, have to buy the antibiotics. There are many other things, like, for example, you can't drink from a straw. You can only drink directly from the cup. You can't smoke. You can't, for at least 24 hours of that, because you can't get a dry socket. Primarily, the more important thing when it comes to specifically extractions is that you have to try and avoid. Primarily, what's happening is that you're trying to prevent your muscles from contracting every time you get an extraction, because what happens is that your blood is coagulating inside the wound, and you want that to coagulate so that way it heals up properly. Every time you do something related that causes your muscles in your mouth to contract, like, for example, lifting is one thing. Even drinking with a straw is something, because you're using that. And even sneezing, because these are things that cause your muscles to constrict, and that constriction in the muscle in your jaw causes the wound to open. And if it keeps happening, then what happens is that it's not going to heal correctly. So, and if it doesn't heal correctly, then you're going to be in a lot of pain, and potentially even more pain than when you had the tooth pain that got to get the extraction. And you have to go back to the dentist, and the dentist has to heal. He has to reopen up the area and stuff so that way it heals properly, and then you have to go through the entire procedure again in terms of the healing process. So you want to make sure that you follow all the instructions that your dentist give you for when after you get an extraction. There are other procedures that also have things that you have to do, like when you get an implant. It's pretty much almost similar to an extraction, just not as extensive. Scaling and root plannings also have them, and these are all things that you definitely have to follow, not only to prevent getting into pain, but more importantly, to allow your body to heal the way, in the best way and the most optimal way. One that's really simple normally is, like, if you get a filling. Fillings normally are very simplistic. It's you should definitely not eat anything or do anything up until the numbiness goes away once you get a filling. If there's any pain that you feel, please go to your dentist, because more than likely what it means, it's one of two things primarily, or not primarily, but more often than not. It's either you need to get an adjustment because the filling might have been too big, and the way that the dentist adjusted it might have still been too high up. So when you're biting, what happens is that the impact that you're having is much bigger than normal. So normally, every person, you all have a specific bite that everyone is accustomed to. It's something you don't even think about it. This is when you have your teeth, your jawbone, and everything, all your teeth. You grow this bite that you get accustomed to, and you don't even think about it. Normally, you become aware of it when you start getting pain, and in most occasions, it can be from either commonly getting a filling, where the filling might be too high, and so when you're biting down, because the bite is different and you're not accustomed to it, you're putting more impact on the area, and that causes the tooth to vibrate and causes pain. So therefore, you go to your dentist, and then what they do is they just do an adjustment where they might lower the filling area a little bit more, and then they'll ask you to bite, and if it feels more normal, then you're good to go. Crowns are the same way. From when you get a root canal, or even if you get any cosmetic work, you want to make sure that that if that happens, then you go and get it checked out, so that way they can do adjustments. On another spectrum too, if you do get a filling done and you do have pain and they do adjustments and you still feel pain after, and it's not only when you bite down but for other things, then it might be potentially that you might need to get a root canal. And then you can ask your dentist specifically why it was that happened. In most occasions, it's just that you had a really, really big cavity and your nerve might have been already exposed, but it was just not visible on the x-ray, because it can happen. X-rays can only view so much, and everything else that is based off to the dentist's expertise. And there's certain things where it's very maybe yes, maybe not, but it doesn't mean that it can't be taken care of. But definitely you need to follow your instructions for post operations, and follow them to the T. They're never for a long time. Most of them are for 24 hours, and like I said, for example, filling is pretty much just for the hour until the numbiness goes away. For example, periodontal disease, when you get a scanning and root planning, one thing you can do is you can do warm water and salt just to help with the irritation that you might get afterwards, once from the cleaning, because the area is clean, your body is not there, so it's adapting to the area and it's healing itself. And then there's certain things that they give you that are post-operative, which help you clean the area better, and allow the body to heal, and it's also less annoying and less cumbersome for yourself. So again, as always, please make sure that you follow the instructions that your dentist give you, because we do it not because we want to annoy you, but because we don't want you to get into any worse situations that you had before. So as always, please flourish and prosper. Have a good day.